So many people, they are anxious and don't even realize it. They get all sorts of discomfort, but they don't know it's called anxiety. So what exactly is anxiety? Today, we have a topic dedicated to this anxiety. I have found anxiety is a huge problem in our entire society. Our Taiwanese society, right, is quite frantic, quite rushed. It's a society of rigid boxes. And we develop anxiety. Anxiety causes a lot of distress. Then you go to the hospital and the doctor's super busy. You can't really talk much. If you talk to friends, you can't explain what's wrong either. So anxiety is incredibly painful sometimes. Its side effects are massive, but we just don't know how to solve it. So to help friends grappling with anxiety, Dr. Fang launched this series. It's called Anxiety Decoded, The Road to Calm. Watch. Stop being anxious. Don't watch. Get more anxious. Today's first episode is I have got anxiety. Again, many people are anxious and don't even know it. They develop all sorts of physical distress, but they don't realize this is called anxiety. They think chest tightness means a heart problem. They think frequent urination means a bladder issue. In fact, these are all linked to anxiety. So for this first episode, I am pointing out this phenomenon first. I have got anxiety. So what is anxiety? Why do we get anxious? Dr. Fang defines it as a threat to existence or survival. For example, take a small animal. In a forest, it senses danger. It feels like a predator is nearby. The perceived threat is concrete. It's very real. Then it starts to feel anxious. Whether it smells something slightly or just feels like there's a risk, it will feel anxious. Not to mention if it runs right up to you. Now, in our modern society, this kind of threat isn't always so clear or specific. For example, today we get sick. We all have this anxiety. Am I going to catch COVID-19 and be the one who dies? I have a stomach ache today. Do I have something seriously wrong with my gut that I have chest tightness? Are my heart or blood vessels blocked? Our anxiety is surrounded by this vague, undefined danger. We worry that we might just go like this and turn into that. We have this symptom, and next thing you know, we'll get cancer. So we easily get anxious. Or there's another kind of anxiety. The anxiety of being isolated. For example, a close friend saw me yesterday and said she has 5 close friends, a group of 5 people. But she noticed the last 2 gatherings. She wasn't invited, being left out. She found this incredibly anxiety-provoking, very heartbreaking. That's the isolation, the anxiety of existing outside the group. So threats to existence are everywhere. From the very concrete, seeing a villain with a knife trying to kill you, all the way to having a sickness with some symptoms, or even being left out by friends. All can create a threat to existence. When we sense a threat, what behaviors do we exhibit? Like a cockroach, a little strong as we call them. When you have cockroaches at home, you'll notice 2 behaviors. When it sees that blue and white slipper, that iconic slipper, it makes the cockroach super nervous. The cockroach runs wildly, scurrying everywhere with no direction. So the first cockroach behavior is chaotic running. Second, when the cockroach finds nowhere to run, it plays dead. It thinks playing dead will fool you. Actually, in nature, playing dead does work. Like a frog, it won't bite an insect that isn't moving. So playing dead can save its life. The cockroach only has 2 moves. One is chaotic running, and the other is playing dead. We humans use these same 2 moves when in danger. One is, what do I do? What do I do? What do I do? Powered by frantic, chaotic running. The other is, it's over, it's over, it's over. And followed by playing dead. When we experience anxiety, we get a huge range of psychological symptoms. So the first is becoming worried. What is worrying? You might say, of course, we worry when something happens. But what is the worry of true anxiety? It's repetitive worrying. Repetitive worrying is different from normal worrying. When we face stress, we worry. We look for solutions. That's logical. But you'll notice a mental state where this worry, which was already thought through, is thought through again repeatedly, and you can't stop. Repetitive worrying is the core anxiety worry. So what is fear? What is it? When the threat isn't right in front of you. Fear is when the danger has arrived right before your eyes. So fear is more concrete than worry. It's closer. It's right there. Say you walk down an alleyway today. The alley is dark. You worry, you are anxious that there might be danger. But then suddenly someone jumps out looking a bit threatening. That's when you start feeling fear. Do you understand? So worry, what is worry? Constant, repetitive, identical worry is anxiety. Fear is danger that's right in front of you. Then you get restlessness. You cannot stop for a single moment. So you keep pacing, doing many things. Restlessness. Eventually, you can't stop at night either. That's insomnia. So this cycle of worry, fear, restlessness, and insomnia is your reaction. It's just like that cockroach running around, unable to stop. Sometimes you also play dead. You also become paralyzed. So what do you develop? You become spaced out. You become paralyzed. Now, why do you become spaced out? Because your brain has limited resources. Your constant, repetitive worrying uses up more than half your resources, so your brain feels empty. You can't concentrate on daily life. You even just sit there when you have free time thinking about all your worries. To appear dull, slow. You seem absent-minded, right? That's being spaced out. And finally, you can't do anything. You feel incapable of handling daily life. Forget about work. You are just lying there, paralyzed, total lack of strength. Sometimes we don't interpret these things that way. We convert these psychological symptoms of worry, we translate them. We believe that worrying is normal when facing issues. I am not restless. I just do a lot of things every day. My insomnia is a distinct illness. My spacing out or total weakness. That's a physical illness. They convert everything. I am not anxious. It's these symptoms that are the problem. Now look, normally we only use a fraction of our brain power for vigilance. Most of it is for handling our daily life. But when you worry, when you are anxious, you use up more than half your resources on anxiety and vigilance. So you appear spaced out, dull, absent-minded. Your brain is even overloaded, leading to feelings of lightheadedness or dizziness. So when some people say, I am dizzy all day, it's because you are overusing your brain. It's the result of anxiety. That's one possibility. Will our body cooperate with our psychological anxiety to produce symptoms? Yes, it will. A body is the little brother to a brain. It will cooperate. First, it uses the sympathetic nervous system to manifest these symptoms. When the sympathetic nerve is excited, it stimulates our heart. Our heart beats faster. Our breathing becomes quicker, and it stimulates our intestines and bladder. What happens? Bladder motility decreases, and intestinal motility also decreases. So we get constipation. We don't feel the urge to urinate much, and our skin, it sweats easily. Our muscles become stiff. This is the full expression of the sympathetic nervous system. Some people say, I have sympathetic nervous dysfunction. Sympathetic nervous dysfunction is just describing the sum of these symptoms. The real source is anxiety. Our brain is anxious, and it drives the sympathetic nerve to act. It's not that the sympathetic nervous system is purely sick. So saying sympathetic nervous dysfunction, that's not a true disease. It's just symptoms. It's the result. It's not the cause. In addition, our brain, this head region, it uses the trigeminal nerve to secrete neurogenic inflammatory substance. So when we are anxious and stressed, our head here tends to hurt because the nerves in our head are quite dense. So why do we feel numbness here, pain here, fullness or dizziness? It's all because this area is inflamed. And why does it get inflamed? Because of neurogenic inflammation. The brain orders the ends of the trigeminal nerve to secrete neurogenic inflammatory substance. And why does the brain cause all this inflammation? Because inflammation causes discomfort to force you to rest, to force you to listen to your brain's inner voice. So these two things, using physical symptoms to communicate with you, the owner. So what physical symptoms of anxiety will show up? First, it's muscle stiffness. Some people say, my neck is so tight, and they are told it's a bone spur. But you just have massive work stress. Your neck muscles have just tightened up. Look at a cat at home. If you raise that blue and white slipper to hit it, when it gets angry, its neck will arch up. So our neck is an indicator of our stress. We just clench our neck like this. Clenching for a long time naturally causes pain and tightness, so muscle stiffness. Then comes trembling, because when our muscles are held very tight, when our nerves are held very tight, it can also trigger trembling. Next is chest tightness, palpitations. Because the heart is stimulated by the sympathetic nerve beats faster, and our breathing to match the faster beating heart. Our breathing also speeds up. So you feel rushed, short of breath, like you can't get enough air. In fact, you are getting enough air, but you feel like you aren't. That's the result of overstimulation of the sympathetic nerve, logically speaking. The sympathetic nerve causes indigestion because the intestines slow down. We get cold sweats because the skin gets cold and sweats, and our mouth gets dry. These are all symptoms of sympathetic overdrive. Sometimes it also causes paralysis because it just stops playing along. So we feel very tired, very weak, very feeble. Some people say, I am not constipated. When I am anxious, I have diarrhea, and my bladder isn't weak. I have really frequent urination then. I feel like my stomach and intestines and my bladder aren't weak. They are even stronger. What's the reason for that? That's because your brain intervenes. If your brain overfocuses on your urine and bowel movements, causing you to have diarrhea, it magnifies this reaction. And sometimes your breathing becomes erratic. You are already short of breath, but your brain keeps telling you to breathe, causing your breathing to become irregular. So the symptoms I circled mean that after your brain intervenes, it makes the whole system more chaotic. Furthermore, it also creates neurogenic inflammation. So you get migraines, neck, head pain, even dizziness or head fullness. These are all signs of neurogenic inflammation. Let's take one example. For instance, when we are anxious, we are so anxious that our limbs go numb. Why does anxiety cause numbness in our limbs? Firstly, nerves are everywhere, especially our face, our hands and feet. The peripheral nerves are quite dense there. So when the sympathetic nerve is stimulated, it can directly cause numbness. Second, when we are anxious, we hyperventilate. Hyperventilation reduces our carbon dioxide. This causes the blood vessels in our brain to constrict, creating a kind of stimulation. So just hyperventilation alone can make your mouth, hands, and feet numb. Is there such a thing as chronic long-term hyperventilation? Yes, that condition exists. Third, it's still neurogenic inflammation. When our brain is stressed, it commands the ends of our peripheral nerves to also secrete neurogenic inflammatory substances. So you genuinely have inflammation. These mechanisms can all make you feel numbness in your limbs. This comes from anxiety. Of course, not all limb numbness is anxiety. For example, Dr. Fang offers a case. A young person recently started taking a calcium channel blocker, a very common blood pressure drug called amlodipine. This amlodipine causes peripheral blood vessel dilation, so he feels a slight sense of swelling, but no visible swelling. So, his hands and feet feel stuck, tight, prickly, and numb. So, amlodipine alone, a simple common blood pressure drug, can also cause numbness in the limbs. Also, the elderly, who just sit all day and don't move, their peripheral tissue fluid doesn't circulate, causing swelling, causing this kind of stimulation. That also causes numb limbs. Finally, everyone already knows that they might be anxious. Some people have more psychological symptoms and some physical signs. Other people mainly have physical manifestations with fewer psychological ones. There's even an extreme type of person who denies any internal anxiety. They say, "Oh, I am retired now. My finances are okay. My children are very filial. I sleep fine too. I don't have any chronic illness. So why am I dizzy? You keep saying, I am anxious. I have no reason to be anxious. If you owed someone $2 million, you would be anxious. That's logical. But as you just said, your life situation is so good. You have no reason to be anxious. If you are still anxious at this point, it's because your brain is unstable. Your brain is a little bit sick. So anxiety isn't always forced by the external environment. Your brain is a little bit sick and you refuse to admit you are anxious. You clearly have many anxiety symptoms. You come to the clinic and talk endlessly saying, I am this way and that way. But you don't realize that you are already anxious. Today, Dr. Fang's topic is to first point out this phenomenon of anxiety. I admit I have anxiety. These physical symptoms I have are just one expression of my anxiety. Then we can start treating the anxiety. Next time, starting next episode, I will look at the causes of anxiety from 6 perspectives. Why do we get anxious? And find some ways to treat it. Thank you all. Want to understand life's problems from a medical perspective? Share this with all your friends and family. Let's elevate Taiwan's medical culture together.